Joining us now from Maputo in Mozambique is Dr. Natalia Tamayo Antabak. She is the head of Doctors Without Borders mission in Mozambique. Welcome to the program. Thank you for coming on. Tell us, Doctor, how urgent is the situation for your health workers and the people that you're treating?
Well, the situation here is quite critical. We have an increase of cases after the introduction of the new strain from South Africa. And in January, we have a duplication of cases, hospitalization and death, with the hospital reaching a full capacity, so the oxygen. Then the health workers are getting sick also, and the ones who are still working are very, very exhausted. Then we don't foresee a good prognosis if we continue with these trends of infections, hospitalization and death.
And tell us, why does it seem that the world is unaware of this situation? For example, in Mozambique, we hear so much about South Africa, but not Mozambique, Malawi and eSwatini.
I think it's a matter, yes, of good communication of the situation. Exactly what MSF is doing is trying to highlight and to expose what is happening in the other part of the world that don't have the press as the more bigger countries. This is our role to highlight that in these countries we are facing a very, very difficult situation, and we don't foresee really a good outcome unless all the measures, including the vaccines, are introduced very quickly.
And just to be clear, Dr. Natalia, you haven't received any COVID-19 vaccines at all?
No, any at all. No, the country applied for the COVAX initiative, and there are other initiatives going on, but until now, we don't receive no one vaccine, no for the health workers, no for nobody.
So how are you managing, and gosh, how difficult is your work made by, I know you've had floods, there are militants as well, so many other factors hampering your work?
Well, here, you know, the country have a lot of problems: HIV, tuberculosis, as you say, floods, cholera. Added to this, you have now the COVID, which is increasing, you know, the risk of the more vulnerable populations. And the COVID is also affecting the health workers, which is a big problem, because who will take care of these people if the health workers are getting sick and are dying? For this, we need the vaccine to protect them.
And what are authorities saying? What is the government saying?
Well, the government, as I say, applied for the COVID mechanisms, but it's not expected to receive vaccines before June or July. What is many months. If we continue with the health system will collapse. They are trying other initiatives, but we don't have a clear answer or a clear view when the vaccines arrive in the country.
And very quickly, Dr. Natalia, what goes through your mind when you see that richer countries have received the vaccine?
Well, it's a matter of equity and solidarity. This is a global pandemic, and for this we need global solutions. This is not a time to selfish approach or to selfish decisions. We need really a better behavior of solidarity and equity for everybody.
Thank you so much for speaking to us. That was Dr. Natalia Tamayo Antabak, and she is the head of Doctors Without Borders mission in Mozambique, a country that has not received any vaccines at all. Thank you.